Hi, I'm Dr. John Catone, and this is MindCube 3D. Today, I have a special guest, Dr. Carla Natalucci-Hall, and she's an expert in EMDR, and we're going to talk a little bit about some topics in EMDR. But first, a little introduction to Dr. Natalucci-Hall. Dr. Carla Natalucci-Hall has been practicing clinical psychology in private practice since 1996. She uses EMDR, mindfulness, and CBT for anxiety, ADHD, small t traumas, and PTSD. She's also developed a unique protocol for EMDR and ADHD. She works with high school and college students to help with their transitions and challenges. She developed the Transitions program for students in high school and college to help optimize their experiences and success. For over 10 years, she's been using EMDR for traumas with individuals and small t challenges with work and with college transitions. She also uses EMDR for performance improvement with work focused on mastering public speaking, anxiety for taking professional tests, PIP, and amplifying skills to support adults at work with ADHD. Dr. Natalucci Hall is in the process now of writing a book about EMDR on work applications. She is a certified EMDR therapist, approved EMDR consultant, and an approved continuing education provider for EMDR IA, including a comprehensive program for the treatment of ADHD, which includes an innovative approach to EMDR resources. She serves as a consultant to other EMDR practitioners for certification in EMDR, and she's a member of the Eastern Long Island EMDR Clinicians Network and is a board member for the EMDR Long Island Network. Dr. Natalucci Hall, your reputation precedes you. Welcome. Thank you for joining us today.
Thanks, John. It's so nice to be here. Thank you for inviting me.
A little background. I invited you to this interview and to put something together for my YouTube channel here and for Psychology Today because I was intrigued by some presentations that I had been aware of that you'd been given on EMDR for performance enhancement. And for me, I don't specialize in EMDR myself. I have patients who have gone to practitioners for EMDR. And for the general practitioner in psychology like myself, I think our associations to EMDR are generally for remediation of trauma, very often sexual trauma. For many of us, the work of Bessel van der Kolk and The Body Keeps the Score is usually a primer or primary introduction into this work in EMDR. And so it's my understanding that maybe the EMDR practice and phenomenon was built out of that, but it seems like practitioners like yourself have taken the ball and run with it even further, not just in the remediation of traumas, but in performance enhancement in various aspects of life. So perhaps if you could give us a little bit of background first into yourself and then when you started doing this work and how you made that transition from remediation of traumas, both small t and capital T traumas, and then into the performance enhancement work.
Absolutely. EMDR is therapy and has been a therapy for a while now because it's a larger schema of thinking rather than just a trauma-based intervention, which originally um, it became useful for. So, for example, veterans or anybody in war, after war, anybody having, and this is a lot of Bessel van der Kolk's work or Janina Fisher's work on trauma, which is violent crime and uh, neglect and child abuse as well as sexual abuse and um, things people would now call, for example, gaslighting, living with or being around emotionally immature parents, to much more severe physical and emotional and other abuse. So this was targeted, and Anna Gomez has a lot of books, a lot of reference to that work. And as EMDR grew, it became more of a therapy because a lot of people were doing a bunch of research. It's one of the most researched therapies out there. And the reason why is because the mechanism of following fingers across the screen or in person or tapping as there's a lot of intervention that way using flash technique with Philip Mansfield, which is another technique, another way in. And these ways in have now expanded to not just trauma, but other things that maybe usually trauma is on the bottom of, right? So when someone talks about fear of public speaking, fear of test taking, fear of other things like that they want to do, like fear of flying, fear of pretty much anything that they're going to do, or they have an anxiety about doing it that prevents them from doing it. And procrastination is a big part of that research there. We use EMDR to address what is the person thinking about? What is the underlying piece? And developing scripts towards what happens when someone has difficulties with their achievement or performance. So myself, I was a child with anxiety. Getting a lot of CBT skills and strategies was extremely helpful. And then when in about 2010 or 2005, I developed a very strong mindfulness practice out of a lot of different areas, losing my mom to cancer, having my own scare, having challenges with my marriage, with a child who had ADHD, other focuses. And then from that, expanding into how can I help other people through my career with anxiety and stress management. So all of these things were like the ground, the fertile ground of how this came about. So in 20 something around 10 or '08, I had a client, nothing worked. So I addressed her because I've always wanted to be EMDR trained for many years, but it was like kind of a West Coast phenomenon. And as it was being made available here for the first time at Hofstra University, we had a training in 2014. I said, I could take this training and maybe we could use EMDR. Maybe we could try it. If you're going to be up for it, I will take this training. I was 50 and I said, I'm going to do this part. I'm going to do a couple of other things because I'm turning 50. And I went and I met a lot of very wonderful people in the EMDR community that are social workers, psychologists, psychiatrists, like you and I in the mental health community and learn this technique. And then as time has grown, the therapy that is part of the EMDR therapy that we can also embrace, not just the technique, but also what goes around it, what underlies it. So in this process, I deal with a number of people. Another specialty of mine is ADHD. I would see how these small t traumas of failure would build up on the person, causing anxiety for doing other things, causing depression, causing stress in their life, in their connections, in their relationships, and really being a barrier. Like this young woman that I was counseling, she was only 16 to 18 was the time that I saw her, and she couldn't go to high school. She couldn't make friendships. She couldn't move on. We did EMDR, and I think it was probably 6 months to 8 months. And she was then able to launch into her next steps. She loved hair, makeup, nails, and she became an esthetician and a cosmetologist and a hair, the whole package, and went on to find support for socialization in Zumba. It took her 7 times to try different groups, but she was resilient now to do that. It wasn't just a crumple. It wasn't just, I'm like, anxious, I can't do it. Or, oh, of course, this happens to me in the depressive function. Um, And she was able to go to like a Unitarian church. She was embraced values, but then she was like, I love the music. And that sonorous feeling of being, there and connected in that way through music was her way into her life. So then she had the triad that worked for her. And when I saw that, I became very involved with the EMDR community. I became a consultant, helping others, training others. I developed my CE program on the ADHD process to see how this really worked for this person who just, some people call it a failure to launch. I just call it just no one's addressed some of these issues
Mhm.
that the person needs to have focus and attention and build themselves. And they need these platforms to like kind of fall on when things don't exactly work out, and the flexibility, the agility, the resilience that EMDR can show them. And what I built in my ADHD program is a very slow reinforcement of you can do so many wonderful things. And how can we just rely on that feeling to just try the other things that we know you can do if you are in that flow state.
Mhm.
So,
So, so now for people who might not be very familiar with EMDR, for whom this might be their first introduction to EMDR, what can you tell us about the foundational principles and how we think it might work?
sure. So, what it's based on is we have an adaptive information processing system. It just works. If there's a trauma and we can digest it, it digests it. And how we know it's digested is it ages. That hurt me. It was upsetting. Not, I'm upset now, because um, the way into understanding the situation here with trauma is, does it bother you right now? If it does, and it happened 2 years ago, this is a memory for processing in trauma therapy in EMDR, right? So the way we would do that, and here's an example from a recent case this week, where one of my clients is reprocessing her mom saying and laughing at her in a group, "Oh, you would be way over the top too anxious to be a police officer." And this happened 2 years ago. We're reprocessing it today. It still
Mhm.
bothers me. Why
Mhm.
did she say that? This pressure with the way of speaking about it, this feeling locked up. I can't talk to the person. I can't resolve it. They'll laugh at me. They'll say, "Oh, you're 2 years ago. That's ridiculous." Instead of really sitting there and saying, "Well, what bothers you?" And we're working on envisioning as well as reprocessing. So we're working on reprocessing, which is ball across the screen, or a lot of people use fingers across, back and forth in a fast way when you're reprocessing it.
Mhm.
And then when you're reinforcing it, it's very slow. Or reinforcing like, I can do this. I'm not helpless. I am able. I'm confident. I do know what I'm doing. These more positive beliefs about oneself. And we do it in a protocol, which needs to be trained. And we have training and we have certifications for that so that people learn our protocol. And it's really identifying the trauma in detail or not at all, because all we need is just this happened or this is the way I feel about it to identify it as a trauma. And then we develop positive and negative cognitions about the self. We rate it, we check and see where it's in the body. And then on a scale of 0 to 10, we understand how disturbing it is to the person. And then we also identify a positive cognition and how true they think it is.
Mhm.
So if the person felt in a situation like this, I'm helpless, I couldn't say anything, then usually the positive cognition is, um, I am able to say something, but they might not believe it at a scale of 7, which is very much. They might believe it at a scale at 1. And our goal, if we have one with EMDR, which we don't need to have one, but the theory is, as we lower the distress to 0 and we amplify the VOC, that's like another scale of how much we really believe it, to 7, then that's when we have a reprocessed memory. The reason why we have these ongoing traumas that have not been just taken into the AIP system and just normally, if that's a word, to reprocess it, is because there's some other basis for why that did not get reprocessed. And that goes into a maladaptive system that then we access using the bilateral stimulation, and it could be tapping, butterfly hug tapping, it could be sounds, bilateral sounds, it could be music. And we also have buzzers that we can use where it buzzes back and forth to activate that system. And then once that system's activated, we go through the protocol and understand what the person is seeing. And when they're able to see this in a neutral way, like, that was just out of my control, that was not really a reflection of me in this particular situation, the person can then have the memory connected to the adaptive information processing system and then age.
So, um, for more general practitioners like myself who aren't trained in EMDR, we might try to do this um, using standard talk therapy, and in many cases, we hit a wall. And so, from your experience and your perspective, something is added with the addition of the sensory stimulation that allows for a breakthrough beyond what just regular talk therapy can get through. Where and why do you think that breakthrough happens with the addition of the sensory stimulation?
Yeah, I'm not sure if EMDR community would call it a breakthrough, but that's okay. It's more that you're showing yourself, right, what really happened and the neurological basis of what's being activated is your amygdala, hippocampus, and frontal cortex.
Mhm.
Is what happened at frontal lobe, in your, part of your brain. And why that is important is because when we have trauma, our hippocampus and our amygdala are caught in this like alarm state. It goes from your amygdala to your hippocampus, and it starts to freeze your brain, particularly your frontal lobe cortex, part of your cortex, and your thinking is offline. And what happens is through the bilateral stimulation, it comes back online in a protected, safe, calm environment where you're showing yourself the trauma that happened. And even if it's trauma that is at a violent crime level or a combat level for a veteran, it shows you what happened instead of your thoughts or feelings or whatever you've taken away from what happened that has gotten sort of like mixed into that trauma and has beliefs about yourself. So when you activate it with the bilateral stimulation, and usually it's very quick for like the first part where you're looking at the memory and you're looking at it and you're running a movie and you're seeing what actually happened.
Mhm.
And it helps you to see what really went on. And it changes the way that you're thinking about what really happened or what's been left with you. And that's the Bessel van der Kolk research. It's been left with you. And that feeling in the body is usually a primary thing to reprocess. And even if we just have that feeling, we can reprocess that feeling because there's something that is part of that feeling. That's the trauma. And usually it's then converts to a negative belief about myself that I did something in this young woman's situation with laughing at her and this feeling, I did something to cause this, or there's something wrong with me, usually is something like that statement. And there isn't. And when they see that with the activation, when they get back their frontal cortex and they're able to think through it, they're able to see that was just an inappropriate comment from someone I dearly love, like my mom, who shouldn't have done that. But it's not that I have to personalize that and take that in. That was out there and
Mhm.
not inside of me. So that really does help the person to then see and add to what they might also have been attaching this trauma to.
Mhm.
And that's where we're going this week is, this relationship with mom is not unconditional, is not always there. And that's hard for someone who's 20 years old.
So, all right, let me see if I understood correctly how you describe this. So, when a person initially experiences a trauma, there'll be activation of the amygdala, sending information to the hippocampus and then prefrontal cortex. But then at a certain point, those centers go offline because I guess the trauma is too overwhelming and they get overstimulated. And then I guess that gets initially stored as a memory somewhere and often takes up residence in some body part. Maybe it's their throat, maybe it's their stomach, maybe it's some other part of their body. And then that physical manifestation comes to represent the trauma. And then, as per, I guess, the Bessel van der Kolk work, over time, people have these compensatory mechanisms to either protect that physical part of the body or to adjust their body in relation to that. And then that can become a larger series of physical
Yeah,
factors and sequelae and so on and so
yeah,
forth. And then, larger illness or injury can occur from that. But
yeah,
then when you come in and do EMDR, the sensory stimulation, whether it's bilateral auditory or bilateral tactile or something like that,
yeah.
brings the amygdala, hippocampus, and frontal lobe, prefrontal cortex back online to kind of integrate this with the traumatic memory. But then now you're going to steer it in a different direction.
Yeah. So when we have a trauma, our amygdala, it's like an amygdala takeover,
Hmm.
and it blasts us with all sorts of like adrenaline, cortisol, ghrelin, all this stuff. And it goes into the hippocampus and it's almost like, oh, like that feeling.
Hmm.
And it shuts down your frontal cortex. You're not thinking anymore.
Hmm.
You have five options: fight, freeze, feign like you're dead, because, I guess animals in history don't like to eat dead meat because it could kill them, right?
Hmm.
You can go way down, and that's the polyvagal theory, way down into, like, instead of here getting activated, going way down into dissociation, right? And then there's other ways that people cope with it that are personal, which that is body keeps the score, a lot of Janina Fisher work, a lot of stuff, psychomotor, sensory motor stuff. When that happens, that memory of trauma is somewhere. You don't know what the real story is because your frontal lobe cortex is offline.
Hmm.
It stopped working because all of this stuff is like, I don't care what this means. I'm just getting out of here. And I'm running away. I'm, fighting. I'm falling on the floor. All these, I'm freezing. I'm going into dissociation. I am not there for that trauma. And we do see this with children. And actually, see it with an adult who was abused as a child. She's like, I don't know what happened to me. I know I have this problem and I have no idea what happened. I have anxiety, I have depression, I have these tensions, tightness in my neck, my shoulders, my throat, I can't have relationships. I can't do this. I can't proceed with my work. Sometimes I can't function because I feel this trauma and I'm afraid. And that's why. And there's nothing here in the world for me to be afraid of, right? I'm away from that person. I don't speak to that person. But yet I still have this trauma. So when we have that, it joins this maladaptive processing system. It just keeps going around and around and around as if that trauma is right here and right now. That other trauma that gets reprocessed is back then and back then. I didn't like it,
Hmm.
but I'm not feeling it now. That's the difference between therapy and EMDR therapy that addresses the right here, right now.
Hmm.
And I think all therapy addresses the right here, right now and the back then, back there. But EMDR brings it together in a way just to show the person, look, that's what you were doing. That's what you did. That's what you were doing. And if you feel that in your body, where do you feel that? Where has it lodged or taken up residency? And activating those parts of like your memory, because now we're bringing the frontal cortex online. We're looking at it, we're seeing it, because sometimes people personalize it. Oh, I deserve to be beaten. I was like this terrible kid. And maybe everybody has like a reaction to a kid that is challenged. However, I think it's not the same as being the way that they were disciplined or hurt in
Hmm.
that traumatic manner. So they come to see like, hey, there was something really wrong with my mom. or something really wrong with my father. And it was like a very big problem that was a trauma. And now I act in ways and treat other people and develop relationships based on that trauma. One lady's 56. She's like, no one can be angry at me. If I feel like I'm a little off, I have to go above and beyond and more and more and more to get back that relationship. And it's a crappy relationship. So now she's seeing like I should have never done that. And I'm not going to do that now with my current employer because it's enough. And every family member has told her that you have to stop this because you're just recreating what happened with our dad. And it didn't work. She was the person that he was traumatizing, hitting, yelling at, gaslighting, undermining, emotionally abusive for her whole life till he passed away.
Right.
So now she recreates it because she's not thinking through it like, hey, I'm treating this person like my dad or my brother who's mentally ill. I'm just thinking I'm making it better. I has to be making it better. But now that I see it, I know my real job is to take a step back from it and go down another road. And that's really what I hope for people to see.
Mhm.
Like they can just stop falling in the same hole, going down the same street, and they can take another street and move away from it because they've reprocessed and seen what actually happened. So that's the EMDR process. The bilateral stimulation starts the amygdala and the hippocampus going, and in a safe environment, in a regulated environment,
Right.
has the person be able to see and work through it with their frontal cortex, which is completely offline during the trauma, and with every iteration, a trigger is what we call of the trauma, because then you're functioning in trauma time, not here.
Hmm. Right, right, right. Very good. Before I ask you for a quick demonstration of the software, I think it's the bilateral stimulation IO software is what you use. Before I ask you for a quick demonstration of that, in your words, can you tell us what you mean in terms of the difference between small T traumas and capital T traumas?
Yeah, I work, another specialty of mine besides anxiety is ADHD.
Mhm.
And this group has tons of small T traumas. Like you failed here, people yelling at you, what are you doing, et cetera, et cetera, et cetera. And those are traumas because it's a in inhaling that or embracing that over time that there's something wrong with me, there's something wrong with the self, how I do things, what's going on, and all those are small T traumas. Another example of small T traumas is when you have anxiety and you have a social engagement and you just can't get there. And then you have a lot of traumatic, response to it. You have a lot of negative thoughts about yourself. You can't do that. Another example is when we can't perform for testing or we can't perform for like speech and stuff and other things of that nature. And when we deal with it in a way that's avoiding it and we just add to the trauma. So, or if we get negative test results, or even if the testing environment, like I forgot, or we go try to enter the social environment and we just can't speak, or the giving the presentation, and people have actually walked away from speaking because they just couldn't do it. So when we have those small T traumas accumulate, what we want to reprocess is every one of them. Like, well, let's just look what happened. And not at a level of the reprocessing that we would do with trauma, but at a slow, low breathing level, a slow, low, we would watch the ball going back and forth, or the sound or the tapping. We would do very, very slowly. And that will help the person see that it is their anxiety and other thoughts and feelings that are going into that activity that's really the problem and not that they can't do the activity. And it frees them up to at least try to do it. And then when they're there to try to do it differently, whether it's social or it's academic or work performance, and then that really helps the person to be emotionally ready for what they want to do. And it could really be anything. But I do specialize in test prep, test taking, public speaking, any sort of speaking in meetings, any sort of like interviewing, any sort of things like that, that people can build anxiety for because of all the things that they're telling themselves based on the small T traumas and the negative things that came out of that in terms of their own self-talk. So here they have this negative self-talk that we will plug into with the EMDR process. And
Gotcha.
the other way we do is an envisioning.
Mhm.
We'll envision what they want to be doing and have that slow bilateral go and reinforce what they would want to do.
Gotcha. Okay.
Yeah.
So, I guess if you feel comfortable, if you can give a demonstration of the software and then maybe explain a little bit about how you would introduce this to a patient or client, regardless of whether, or I guess in both cases, one where you were remediating a trauma, and then in another where you were trying to improve upon, some sort of performance.
Sure. So with the two different ones, EMDR has become very, very popular, and it's been in social media, it's been in shows, movies, and stuff. Prince Harry is like the most celebrated one at the time, but there's a lot of other people of note or in the media, different. I've even seen it in like a series and other shows and movies. So it's been very popularized as a therapy and for dealing with certain things and on both ends. So
Mhm.
a lot of times people will come through EMDRIA, which is our organizing international association, and they will ask for it because they've tried all these other therapies that work somewhat,
Mhm.
but do not resolve their challenge with whatever they're thinking. And a lot of times I will work in tandem with someone who is in another therapy, even if it's twice a week there, and we'll do once or twice a week or 90-minute protocols for EMDR specifically over time to address the trauma or to address the performance. So they already have like almost all my clients have another therapist that then this enhances that experience, right? So when it's trauma related, we will discuss that happened. How much does it bother you now? And if it's not, that much, we will go on a small T trauma protocol. If it is, we'll do the regular protocol, the standard protocol. And that is the way that we will deal with the introduction of it, like trying to understand the history, which a large history is taken. When someone wants to say, I don't want to deal with any of that. I just want to do better on my tests. I want to do better at work speaking. I want to do something better. We start from exactly where they are and we developed a script from before they're going to do it, through doing it, to after they're doing it, through the times connected between the time they finish and the next time they do it. So playing an instrument, like practice, lesson, performance, whatever it is, we will develop a script for all of those situations. And a lot of times it's clear that what happens for performance is what happens before the performance.
Mm.
And in the performance, if there's like a little bit of a like problem or a glitch or like a misspoken word or a note that's played that's not the right note, and instead of having that alarm and shutting down, we have things that we are putting into our processing with the frontal lobe cortex saying, that's just not a problem. I know I can hear it. If I was in a lesson, my teacher would hear it or somebody else would observe it, but most people probably didn't even hear it. And if I just keep playing and going back into my low, slow breathing, I will be just fine. And I can work on practicing that so it gets better, or it just feels more comfortable, or I get into my flow, which is the most ideal.
Mhm.
So that's the way that we do it. So the scripting is for like test taking, music playing, or lessons or performance. Any sort of sport, anything at work, especially like public speaking, presenting at meetings, even having performance improvement programs go better, to have like even interviewing go better, contracting be much more specific and much more understood by both parties. So there's less of a challenge later or stressor later to deal with. So it's very important to do. Actually, it's important to do both. So even though we've reprocessed the trauma, we do get to, in every processing, what would you want to be thinking of yourself instead? What's the positive cognition or thought?
Hmm.
And then we reinforce that before we consider a memory completely reprocessed.
Gotcha. Um, One other quick thing that I think might require just a little bit of discussion before we get into the demonstration.
Sure.
Um, so a lot of what you hope to do is built on the theory of flow states and such. What can you tell me about that and how that integrates into the EMDR process?
Flow is a positive psychology concept that was introduced a long time ago and by Russian psychologists. And what we need to do is to understand that we can do all the things that we want to do or need to do in this flow state. You just need to get to it with low, slow, deep breathing, feeling connected to what we want to be doing in a positive manner. And then our ability to do things maximizes from a standard, say within the normative range, or really working hard to do it, to it just feels right. And I'm over here just feeling really good doing what I do.
Mhm.
And how I work with people is, what do you like to do?
Mhm.
What is it that you embrace and you really enjoy doing? And what makes you smile? What makes you feel good already? And we use that to reinforce that flow state. And a lot of people are doing wonderful things at a high level, and we just need to get them to remember how they're doing it when they're at that level. So when they bring it to, say, for example, work, or they bring it to school, or they bring it to just social engagements that are maybe more formalized or maybe just more people or more challenging in some way, they can remember, like, I can talk to my friend really easily, my mom, my dad, my sibling, about a topic. And it really helps to reinforce that so that when they get into like a stress situation, they can use those skills and that muscle memory in this situation. That's the flow state that we're thinking of.
Okay. So my association to this stuff comes a little bit from Zen, and my understanding of Zen is that, I think people have a lot of associations to Zen and obviously meditating and sitting cross-legged on the floor, but my understanding of Zen actually is that in order, well, the goal, for lack of a better word, is to be operating spontaneously, essentially from your gut in a way that I think might be similar to a flow state. But you can't just operate from your gut without training your gut. You have to train your gut with
Exactly.
repetition and practice.
Yeah.
It's almost like walking. You don't think about walking anymore, right? You could step on a rock and your body knows how to adjust your feet and your body, the rest of your body, to the misstep on the rock preconsciously before you even have the chance to, make the mental adjustment. And so my understanding from a Zen state as well as a flow state is that you've practiced something so much that it becomes kind of unconscious or preconscious and it's just kind of flowing. But the practice is the important part.
Yes. So
And
in between the reprocessing, we have people practice what's a butterfly hug, very slow tapping and breathing, envisioning like a calm, safe place, or whatever words work, because sometimes people are triggered by calm or safe. So my place that makes me feel comfortable or in flow, or envisioning that way of what I would like to be doing or how I'm in flow, right? And tapping. You can tap your shoulders, you can do your legs, you can tap your feet at meetings or underneath table, you can tap your, body. And to envision that throughout the day, every day, especially if you wind up being in that situation,
Mhm.
that would be helpful. Having your script that says, I'm fine, I'm good, I got this, I'm in flow, this is what I love to do, this is my happy, thing that I like. And just to every day envisioning. And I recommend, like, in the morning when you're kind of sleepy before you get out of bed, just doing this envisioning. You can do your tapping, doing that breathing, calming, anchoring into your body. And when you go to sleep, those anchors are very helpful. But even throughout the day, just coming back to self, because I also do a lot of mindfulness meditation and breathing. And it's all about the now. Everything is about now because our anxiety is based on the future and the past. It's what I didn't do, depression. And being in the now shows us right here, right now, this is how I'm being, this is how I'm feeling, this is how I am. And that in itself creates a lot of grounding and flow. So if we can plug into that,
Mhm.
and the tapping helps people to come to their body because a lot of people kick themselves out of their body doing their day or in their dissociation or not to feel their anxiety or trauma while doing that. And if we can come back and ground into our tapping, into our seat, into our feet throughout the day, it does help to create that like flow of energy in us and around us. And our even our relationship to others becomes like very sort of organized and feels like this tempo is good and we have got like really good boundaries and stuff and we come and go kind of like with ease like that's the flow and having flow throughout your day and that's part of my new program powerful self-compassion and care is when we're self-caring that way we don't build this stuff up and take it home later. Oh, I'll go to the gym later, I'll relax later. We do it in the moment. Oh, that was difficult, let me take a deep breath. Let me ground. Let me take a walk. This is a good time to go to the bathroom, get a glass of water. Self care, self care, self care. And to even write down that was really crappy and to throw it out or shred it because that does not build up the traumas that we're talking about later needing to be reprocessed. And that's that small t trauma thing.
Mhm.
We don't need it. You don't need it. It's unnecessary. So the more you're able to get in that flow, it does resemble mindfulness meditation. I have never done Zen, but I would imagine there's some connections there with Zen or just meditating just a little bit at least. Um, and that focus on the now, right here, right now,
Mhm.
right here. And then if my head is, bothering me, people tap their head or they put the buzzers on their head or their shoulder, or they put their hands on their shoulder or on their heart, remembering right here, right now, and sort of addressing like this is very difficult right now. And that self-care, that's part of it,
Mhm. Gotcha.
right? So
Great.
yeah. Would you
So,
like to do the
yes,
demonstration?
without any further
We're
ado,
ready.
do a little demonstration, and
Okay.
you could use me as a subject if you
Oh,
like.
good. Yeah,
Sure.
let's do I think we were talking a little bit about how you're learning to play the guitar. So let's do that.
Okay, sure.
That'll be fun for everyone to
Mhm.
see. So I'm sharing my screen.
Okay.
Good. And I already brought up the screen that we use for bilateral IO. And what's nice about this is people have a choice of the different ways that they can do bilateral stimulation. So you can do visual, auditory, or tactile. You can do one of them, you can do all of them. The person, the client gets to decide. Or if they're like, I just want to do the sound and do my own tapping as a butterfly hug, either way or tapping on their legs. That's possible too. If they just want to do the tactile, it's like a whole another system that you buy, you use, which is also very effective. You can even put it under your legs. You can put it in the kids like it in their shoes,
Mhm.
whatever works, right? So say today we're going to talk about John learning the guitar and enjoying it, wanting to do it for whatever reasons. And if we've decided to do the visual and auditory stimulation. Right? So I think before we were talking about the blue and the guitar. And let me just see if the sound is still shared with you. Yep. So we're good. And now we're going to bring it up as a bigger ball on the screen.
Mhm.
And what you're going to do is developing a script in the session, right? And I think we talked a little bit about a script before about what you're doing before, what you're doing during the lesson, what you're doing after the lesson, and your point to what should I do between lessons and sort of getting into the breathing, doing the tapping, envisioning the practicing, doing the practicing, finishing the practicing, envisioning that, that was made me feel good. I
Mhm.
can do this. This is like where I want to be. This is what I want to do. Seeing even like the smiling faces of relatives, friends, that I'm playing the guitar in the future, embracing that, kind of feeling in my body. And that's what we want to do, that flow. So
So
when,
while the ball is moving, I'm visualizing myself succeeding, playing. Um,
yeah,
okay, so
yeah, when we don't use terms of succeeding, we're just going to be in flow of like you're going, what are you doing before you're going to your lesson?
mhm,
Then we'll transition to what are you doing at your lesson? And the beauty of EMDR for a lot of people and why they really enjoy it, sometimes it's like such a difference between talk therapy because they just don't need to talk so much,
mhm,
even with trauma. Oh, this happened to me. I don't want to say anything else about it. We can do that. Whereas in talk therapy, it kind of I've had the experience of it kind of shuts it down. And with the young people that I've seen, sometimes they don't want to talk about it. It shuts them down. So it can reprocess whatever's going on, even if the person is just like, I don't want to talk about anything. They're there to reprocess it. But with envisioning, which is what we're doing with this, you're seeing yourself before, transitioning to your lesson, transitioning out of your lesson with that nice breathing, low, slow breathing, and saying things to yourself like, oh, this was nice. I really enjoy this playing my guitar. I enjoy my lesson. I enjoy my teacher. I enjoy my time that I'm giving myself. And then afterwards, oh, that was nice. And that I feel like I can do this chord or the strumming. And that was nice. And then seeing people around you like reinforcing and supporting you. Oh, that's great, whatever you're doing. Not performing at a song or at a high level, just, oh, that's great, or that's nice. Just envisioning them and having them be your internal support system. We develop like nurturing objects that are around to help us through these processes or to reinforce when we're going through things that we want to learn and we want to do better, right? So now we're going to look at the screen straight on. We're not moving our head. We're focusing just with our eyes. If any body parts, legs, or anything are crossed or uncrossing them. And just finding a way to breathe. And I'm going to start the ball, and that's going to go back and forth at a slow level. And you're thinking, picturing, imagining what you're doing before your lesson. If I was to narrate it, maybe you're getting ready to go, you're getting your guitar, you're envisioning having a good lesson, you're walking or driving over in a calm way, or whatever story or narrative or script that goes with it. But very specifically, doing this, breathing. And when we breathe, breathing down into our stomach and then up, almost like you're smelling a plate of food or flour. Yeah, and just breathing into your stomach as you're envisioning going to your lesson and going into place you've chosen, connecting to your teacher, learning and being in the lesson. Well, this is the way we do this. This is the way we do it. Smiling through your body. Just noticing how nice it is to be here at my lesson. Getting into your flow state. Slow, slow breathing into your belly. Into the bottom. Breathing up. Opening up. This wonderful experience you're having. Your guitar, your teacher, your lesson. And then envisioning back in your car walking, thinking of what a night's time that was, whether it was challenging or difficult in any way. I was there, I was doing it, that was great. Just breathing in deep, Slow, slow breathing, breathing up all the way down. And then saying, oh, that was great. I can do it. And just envisioning the people you love care for you your whole life until now and beyond. Just around you in a circle of love, support, and healing and nurturing, calming you. Maybe just smiling, maybe not saying anything, letting their feelings towards you go to your heart, shine into you, reinforcing this nice activity that you did, this goal you might have, just being here and now, just for another minute, taking the whole experience in. And it might be a feeling in your body, in your chest or your stomach. That's a good feeling. One that you had some nice food that you love. That's contentedness, being close to others in a way you like. Just bringing that with you in a relaxed way. And just taking a breath as I transition. And then we would stop. And typically, I will take down the site because it's so much easier to talk with someone just looking at each other and just sort of going through what the script was. And we're going to get really specific over time. And that's what then the person can reinforce
Mm,
moment to moment in the middle of their reprocessing or their reinforcing or envisioning and their lessons and all of their different practices so that they can understand this is part of me, this is from me, this is connected to me, this is good. And keep leveling up that comfort and that quality of experience till they feel, connected to it in such a way that it's a flow state. Oh, that's what I do. It's part of me. It's what I do. Even some of their guitars are like feeling like an extension of self, having a good feeling. Some people name their guitars. They decorate them. They have that real close connection to this is what makes me feel good. What is that part of me that I'm connected to? So when we have this with stress related and people can't break through that testing, they just lose all their information when they start a test. We start at the bottom of like, let's go to that breathing. Let's go to just weeks out from a test.
mhm,
Build and build and build slowly, slowly a comfortability, a comfort zone with
right.
this is what I do. And it's the next thing. It's just the next thing. It's the next thing. I have to go to the testing center. It's the next thing. It's just the next thing.
So on the day of the test or on the day of the game or the day of the concert, they might not have the software with them, but if you've already trained them to do the butterfly tapping, I guess either before they've done the
You
software
can.
simulation
We
or
call it a
during it.
pre-performance routine.
Hmm.
Yes, pre-performance routine is established, and that's why we want to get really specific on the scripting.
Hmm.
The pre-performance routine is always practice, even before they go to their practice, and
Hmm.
then on the way to their practice, and during phases of their practice. And you'll see it now in professional sports.
Hmm.
You'll see it in football and basketball, particularly. They have actually mindful coaches and performance coaches to use these techniques. And you'll see with the stretching, breathe in, stretch, envision. Oh, this is me, using that muscle. So when they're actually using it in their sport, it's connected to this flow.
Gotcha. Yeah. I wish this was around when I was in college. I played baseball in college, and who knows, if this was around in college, I might not be a psychologist today. I might be a baseball player. But do you work with athletes? Do you work with
I
teams?
do. I work with swimmers. I work with runners. I work with people who are in the Olympics. I'm part of the USOC, the mental health registry there.
Wow.
I've worked with someone with, I think it was Taekwondo, and then went into judo and then became a Paralympian because she has a disability. I work with people with disabilities. It's possible to do EMDR with people with disabilities, part of my background.
Mhm.
Um, I work with people who have goals of like being in medicine, being in law, being in high level, sort of activities every day with a career orientation, even through school. I work with a lot of college students, graduate students, medical students, law students, psychiatry students, particularly when they have these challenges with clients where it's overstimulating and vicarious traumatization happens. So we were just talking about that yesterday in one of my meetings, how to actually have self-care after every session, because sometimes looking at people's faces and journaling and stuff will help them see that that happens. And we don't always notice it till later when we're like yelling at someone or feeling stressed out or needing a drink, which is another topic, or other, relaxant that is perfectly understandable. But what can we do in the moment to channel that? A difficult meeting at work, being on a performance improvement program is very challenging, very stressful. And then we bring our own selves, like our relationships, our financial issues, our health issues around with us. So, or even if it's a loved one that's having a problem in this one way or another. So we want to learn that grounding and that self reinforcement, and then making space for self care, making space for self, you know, just things you love to do. Like self care embraces that too.
Mhm.
So if it's guitar playing, if it's tennis, if it's hiking, if it's make space for that too, because that self reinforcement of things that we love to do, there has to be space for us to have that total nurturance of self, of the big S self, like an IFS, big self, because that is always there and we need to take care of that. And all these isolated parts, we all have them that are exiles and other things from the IFS, perspective, that integration where we cannot fear like that part that always messes stuff up for us or always gets involved with like these difficult relationships or says that something, then we're like upset because we just put a kibosh on things we've been working on for a while or whatever. And just welcoming that outside self. Not, you don't want to be integrated, that's okay, but let's flow together. Let's have a flow. It's okay. It doesn't have to be a threatening situation.
Mhm.
Or we also have other people in our lives, people we care for, people who are difficult, situations that are difficult. So every moment is an opportunity for self-care. And if you think of EMDR for trauma, EMDR for improvement or performance or just self-care, it helps us to expand that level. And the tapping is wonderful. Laurel Parnell has a whole program just on tapping that I'm going to be doing at the New York State Psychological Association annual meeting this year. We're going to do tapping and we're going to do bringing nurturing objects to be with us all the time. And yesterday, someone was saying having those nurturing objects there all the time and working in concert with each other to support us, imaginal in our minds, but also in our environments, could also be this network of people in our homes, in our families, in our collegial environments. And I think all those things are really important. So you can see how we start at a point of trauma and we wind up as, even if it's for some of the military post-traumatic growth, we can apply that research, which is vast,
Mhm.
to we all can have growth and development, intentional or over time. If we intentionally use these self-care skills, we will
Right.
grow and then we will shine. And what is really important to us comes out, and we can connect to others more authentic and with authenticity and authentically and with calm, peaceful feelings and walk away fulfilled and channeled and feeling good about who we are and what we do and how we connect to others. Not depleted and burnt out and we have now we're going to do it. No, 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 no. let's proactively
Mhm.
stay in that flow, stay in that good feeling.
And to maybe paraphrase one of Frank Sinatra's famous songs, maybe you and I could do a cover. Once I learn to play the guitar, we can do a cover and sing "Come Flow with Me." Come flow
Ooh,
away.
yes. Yeah. And
Um,
that is the premise of EMDR, flowing.
mhm,
Flowing, and it's the premise of mindfulness awareness and being in the now, this flow, letting yourself be where you need to be when you need to be. And taking time for self-care is something to do as well.
mhm.
And elevating it to the point where you need it and you want it and you love it and it's part of who you are is a good goal.
Thank you. Before we break, if people want to learn more about what you do or even avail themselves to your services, what would be the best way for them to do so?
I have a wonderful website that I created with my son, who's amazing in COVID. And it goes into a lot of these things. I have a lot of talks on a lot of resources. So it's my name, Dr. Carla Natalucci, and or you can reach me at drcarlanatalucci@gmail.com. And that's on my website too. I love meeting new people. I'm starting groups for the powerful self-care. And I adore the work that I do. I'm so privileged to have the work that I do with the EMDR community and the mindfulness communities. I feel like it's made such a difference in my own life, and I do it every day, letting go, exercises, embracing these elements of self-care because it's so valuable and it keeps me, and I've been doing this for over 30 years, and I think a lot of people at this juncture are just like, I'm done, I'm tired, and I'm looking forward to like really embracing this powerful self-care project with mindfulness and implementing and including a lot of the EMDR premises of self-care and tapping into it. And I think it's so valuable that I'd love to share it with everyone. And I'm giving that talk at NISPA. I gave the other talk from Fordham, the students growing and launching. And I would be open to any sort of talking to other people about it. That would be great.
Excellent.
Yeah.
Yes, well, your enthusiasm, your love of the subject, and your passion definitely does come through very naturally and easily. And so I thank you so much for your time, for
Thank
your
you.
knowledge, for your wisdom, and I wish you well, and we will be in touch soon.
Yes, you too. You too. Thank you again. Take care.